So if you're only missing one tooth, why a dental implant over a traditional bridge?
Okay. Well, first of all, it's stronger. Studies show it lasts longer. Say if you do 100 bridges versus 100 implants and study them over 10 years, what do you have at the end of 10 years? The implants win by, not by a mile, but they do win. The biggest advantage, you don't have to remove the enamel off the adjacent teeth. And so you leave the other teeth alone. It's a freestanding implant. You put its own root in, that's why it's stronger. Now, there are times when a bridge is actually not a bad idea. Let's say the teeth on either side of the space need a crown anyway. And then you go ahead and do the bridge and kill two birds with one stone and take care of the problem and replace the missing tooth with the bridge. And so we still do bridges. But assuming the teeth on the adjacent teeth are healthy, and it's not like a dentist would ever put a crown on those teeth, then it's best to leave them alone and then put the implant in, and then the other teeth are undisturbed, untouched. You brush it and floss it just like a tooth.
So these implants are like permanent teeth. They're going to last as long as you last.
That's the idea. Yes.
Okay. And what about pain? Does it hurt?
Especially for a single tooth. I mean, nobody believes me, but the vast majority of time when we're placing a single, say they've got adequate bone, we just place the implant, the vast majority of patients tell me, so, well, I took a Tylenol and that's it. There's a little bit of soreness, but it's not, taking the tooth out is way more traumatic to the patient and way more uncomfortable than placing the implant. And of course, nobody believes me. I always tell this afterwards. Well, you didn't believe me, and so I said, well, no, I didn't. But yeah, you're right. It was nothing. So most of the time, you can just place the implant. There are not even any stitches, and you could place the implant right in there, and a little soreness, and that's it. Maybe an Advil, maybe a Tylenol, and after that, it's a lot easier than you think.